Hello.
Good evening, everyone, and welcome to this Health and Wellbeing Scrutiny Committee on Tuesday, the 12th of November 2024. So, may I remind everyone present that this meeting will be broadcast live via YouTube, and the recording will be archived for future viewing. Could all council officers ensure that when they speak, they switch their microphone on, and when they have finished speaking, switch their microphones off? This is extremely important for the live stream to ensure that the cameras will be focused on the individual who is speaking. Okay, thank you very much. And then we'll have some nice practice in now because I see a few faces in the room. Welcome to this meeting. I'd like to go start with me going around clockwise and then introduce all ourselves. So I'm going to start. My name is Thomas Hadley. I'm the chair of the Health and Wellbeing Scrutiny Committee and councillor for Burton Eaton Ward.
Emily Thomas, Corporate Services Apprentice.
Daniel Corkett, Democratic Services Officer.
Michael Overs, Communities, Open Spaces and Facilities Manager.
Charlie Bird, and Participation Development Officer at the Brew House.
Philip Atkins, County Councillor, Uttoxeter Rural, County Council representative on this committee.
Good evening, Alison Legg.
Good evening, Councillor Colin Wellman.
Good evening, Councillor Bernard Peters, Brislingcote Ward.
Good evening, Councillor Kim Smith at Windsor Ward.
Good evening, Councillor Monica Holton, Burton and Eaton Ward.
And excellent, back to me. That's better than last time. We're improving in that regard. Excellent. So we'll get onto the agenda. Have I any apologies for absence?
Thank you, Chair. No apologies. Everybody's present.
Beautiful. I suppose there's some people on Zoom we should be able to introduce. So can we go to Councillor Beach first and then go to our guest?
Hi, I'm Councillor Laura Beach of Staffordshire.
Thank you. And Fiona?
Thank you, Councillor. Hi, everyone. Good evening. I'm Fiona Miller from Beat the Cold.
Beautiful. Thank you very much, everyone, for that. Any declarations of interest from anyone? No declarations of interest. So we'll go to item 3. To consider any urgent business brought forward to the meeting under Rule 12. I'm not aware of any urgent business for consideration. So agenda item 4, questions from the public. We have not received any questions from members of the public. So going to agenda item 5, questions from members of the committee. We have not received any questions from members of the committee. So item number 6, the public minutes of the previous meeting on 7th of October 2024. It's been in enclosure 1, you'd have seen this. I propose the approval of the public minutes from the previous meeting. Do I have a seconder? Councillor Holton. We shall now go to the vote. All those in favour? Any against? Any abstentions? Thank you. The minutes have been carried. So that goes straight to item number 7, Beat the Cold. I now invite Fiona Millen, who's on Zoom for us today, the Chief Executive Officer of the Beat the Cold, to provide a short presentation.
Thank you, Councillor. I'll just share screen. Okay, can we just confirm in the room that that's visible for everyone?
Yes.
Good, thank you. And thank you for the warm welcome. Good evening. It's great to be with you all this evening and an honour to present our progress so far. So for those, I'm aware that there are new councillors in the room who might not have been privy to Beat the Cold in the past. So I thought it'd be good to start with a little bit of an overview and to really talk about the health guidelines that underpin our work before we dip into our performance for the previous financial year. So Beat the Cold, we've been around for over 2 decades now. We specialise in delivering fuel poverty advice to Staffordshire residents and more lastly as well energy efficiency advice. We have, as I say, over 2 decades of experience. So we were pivotal in a guideline called NICE Guideline 6 and that we will talk about in a little bit more detail shortly. Really underpins all of our work and the way that we operate. It sets out how we work with vulnerable people. So many of you will have heard of the Keep Warm, Keep Well programme. That's been going now since 2016, and we work very closely with the healthcare sector to deliver that programme. So all of our advisors are qualified. So there are specific benchmarks in energy advice work, and all of our advisors are qualified to the highest level, level 3. And at the moment in the present team, we're lucky enough to have over 50 years of energy advice across our energy advisor team. So as you're aware, and one of the reasons I'm here this evening is that we are commissioned by Staffordshire and Stoke-on-Trent local authorities to deliver energy advice to residents. And what we're able to do is bring our expertise and our decades of reputation to leverage additional funding and finance for East Staffordshire residents, and we can do that with organisations such as National Grid, Energy Saving Trust and Citizens Advice. And so by commissioning Beat the Cold with a contract, we're able to then match fund and in many cases as well likely go over the funding to bring that to the area. So NICE Guideline 6, for those who may not be aware, is the snappily titled Excess Winter Deaths and Illness and the Health Risks Associated with Cold Homes. So joking aside, really serious topic here, and I think that we're all aware of the potential of winter deaths in certain circumstances, particularly where homes are in the top 10% range. So the aims that the guideline sets out are to improve health and well-being within vulnerable groups, to reduce pressure on health and social care services, reduce fuel poverty and the risk of fuel debt, which we'll look at shortly as well, and more of a definition around fuel poverty, to improve the energy efficiency of homes. I think this will be on a lot of radars, particularly with the government programmes such as ECO and GBIS, and to reduce preventable excess winter death rates. So some really high aims and some really serious aims as well. So under the NICE guidelines, the definition of vulnerable groups are quite broad. Some of the terms which fit into the vulnerable groups are people with particular morbidities, so cardiovascular conditions, respiratory, mental health conditions, disabilities. And then as we would expect, older people, households with young children, so children under 5 are particularly vulnerable to cold, and also people on a low income who just have not got the means to heat their homes to safe temperatures. So in terms of fuel poverty then, there's a definition that some of you may have heard of called the Lilly indicator. And under the Lilly indicator, there are a couple of measures that work in tandem, and a household is to be considered to be fuel poor if the property has an energy efficiency rating of band D or below, that's the EPC rating, and the spending required to heat the home leaves a residual income below the poverty line. So there's a way that I like to think of this just to make it stick in my mind. It's really 3 competing factors that are all working together. So you're looking at household income, energy prices, which we all know have been very volatile in the last couple of years, and finally the property condition. So evidence shows, as we say, that fuel poverty does have a direct impact on morbidity, including those conditions already mentioned. And also as well, mortality rises almost 3% for just every 1 degree reduction in the coldest 10% of homes. So that's quite a frightening statistic, and really our goal is to underpin our work with the NICE guidelines to make sure that we reduce these excess winter death rates, because fuel poverty isn't just about comfort levels. This is literally a life and death situation. So So moving on then, just a refresher for anybody who's not quite familiar with the contract aims. So we're now we're reviewing the second year of the contract, and part of the aims of this contract were to make sure that we're targeting the right resident groups, especially those that are disproportionately affected by fuel poverty and also rural energy disadvantage. To be innovative, to aim to be inventive and find new ways of tackling the main causes for concern surrounding energy, affordability, security and carbon emissions. To be practical, to make it accessible and inclusive, and to also be sustainable and make sure that not only is the service viable, but it meets today's needs and also considers future requirements around sustainability. And the objectives include to provide an energy advice service, and that's a combination changing resident behaviour and upgrading homes, offering extra advice and support to vulnerable residents, maintaining and actively promoting the brand to make sure that we work with professionals across the sectors, incorporating the Affordable Warmth Programme as a mechanism for improving health across the borough, and identifying and advising on retrofit projects. So again, that's, as I mentioned, Eco4, GBIS, you might have heard of these schemes, and also the performance monitoring. So let's have a look then at the performance over the last financial year. So in 2023-24, Beat the Cold supported 339 total households in East Staffordshire, equating to 442 enquiries. Out of those, 78 households were added to the National Grid Priority Services Register, and this is a programme that restores power in the event of an emergency for those who are most vulnerable, and especially can include medical care equipment as well. 27 households were referred for a retrofit grant. 88 of the households we worked with reported straight away an improvement in their wellbeing. 134 households were referred for a heat grant through the Household Support Fund. 20 food bank vouchers were issued. Now, in terms of vouchers, although that's still a startling number, we are seeing really that East Staffordshire, compared to some of the other boroughs and districts, these numbers are a lot lower. I think that's a good indicator of your residents and their needs at the moment. So although it's sad to see that on there at all, I would say that the numbers being low is quite a positive indicator. I do appreciate as well that there are not as high concentration of food banks in the area as there are in certain other boroughs and districts, and that will again be driven by need. And it might, for some of you, raise a question, why do we issue food bank vouchers? So we really refer on we very much offer holistic support, and as part of fuel poverty prevention, advising residents to have proper nutrition and eat a proper home cooked meal will actually support with their body's ability to maintain their own body regulation and temperature. So 83 households were referred for water support. So these three measures across the middle here are what I would think of as our crisis intervention. So in an ideal world, there'll be none of these numbers there, but we know that whilst there's a need, particularly with the cost of living crisis, which was the height of this period, that actually we are able to offer the very basics in heat, food and water. So during the contract periods, 4 community events were attended, 8 home visits were delivered, and 17 households were referred through the earlier mentioned Keep Warm, Keep Well programme. So that's referrals coming in to Beat the Cold directly from our links with the healthcare setting. So this translates to a potential value to the community and savings and grants of over £500,000. I think considering the contract value, that's a really great potential saving. I will caveat that and say it is the potential value. So not every one of those retrofit referrals, for example, would have turned into work, but it gives you an indication of the types of numbers that Beat the Cold send in through there. And I'm sure you'll agree that with the value is quite high. So let's have a little look at the beneficiary profile. So the residents that we worked with, almost half of them were disadvantaged through both poverty and health. Almost a quarter of them were disadvantaged through poverty, and 14% had a health condition only. These are measures that we found really important to track, and it's pleasing to see that we're absolutely reaching the right people. So in terms of the age range then, the highest age range that we work with, surprisingly for some people, it was actually the 40 to 65 age brackets. We are seeing this across the board, that actually people of what we would typically think of as working age are needing our services more and more. And that was closely followed by 25 to 39. So all the working age groups are a higher percentage than the 65 plus. And this is something, and I'm sure it will come out in questions, that is a really interesting picture. We're expecting for 24-25 this picture to shift, given the changes in policy around winter fuel payments. And we're already starting to see that we're working with more of the 66 plus age group in 24-25. So it probably won't surprise you to hear that the bulk of the service users that we worked with were either unemployed or long-term sick, and this was then followed by retired. But also we are available at Beat the Cold for everybody, for all residents, regardless of people's situation or status. And so we work with employed people, and we've also worked with self-employed people as well. In terms of tenure, the highest tenure that we dealt with, and this likely mirrors the area profile, was owner-occupier, closely followed by housing association. So we're going to summarise then and bringing this work to life. I always think it's great to have case studies because it really cements the broad range of work that we do. So we've got 3 case studies to look at. The first one is a classic beat the cold situation. So this resident had actioned what we see quite frequently. It's quite alarming, is that as they cannot afford the cost of heating and start to panic, the heating's actually getting switched off for longer periods. That leaves people in cold homes. It leaves them susceptible to the impacts of cold and some of those frightening statistics that we saw earlier in the presentation. So this particular resident lived alone in a 2-bedroom flat through housing association, was in the 60 to 69 age bracket, and health conditions included limited mobility, and the resident was retired and self-referred over to Beat the Cold because they were concerned on how to afford the winter heating bills, and they were currently, as I say, leaving the heating off. So we worked with the resident, we performed a full triage, and as she'd been so worried about the heating bills, we talked to her about affordable warmth. Now, typically in healthy groups, we would recommend a temperature setting of around 18 to 21, and that can need to be slightly higher if somebody does have significant health conditions. That then leaves people concerned of how they can afford to heat as much as they need to at those temperatures. And what we suggest there is that they use the TRVs, the thermostatic radiator valves that you'll all probably likely have on your own heating systems, to make sure that the rooms are heated accordingly, so that frequent use rooms such as bedrooms and lounges are heated more so than hallways and kitchens. And we were able to provide this behavioural advice so that we could get the heating bills down, and talk to the resident about, rather than trying to use the heating at higher temperatures for a lower time, to have the lower temperatures for a longer time, and actually that ends up being more cost effective. We were also able to provide advice on tariffs and further energy saving tips, and we find that that does support with costs and usage over time. In the short term, we wanted to be able to provide this resident with peace of mind, and so we were able to refer for a heat grant, so that crisis support we were looking at earlier through the Household Support Fund. And that would straight away have an impact on the residents starting to use the heating system, and so therefore alleviating the risk of the cold home. We were also able as well, we work very closely with DWP and partners in terms of benefits maximisation, and we were able to send a referral over for attendance allowance. And then finally, we added the resident again to that priority services register for peace of mind in the event of a power cut. As an outcome, the resident reported an immediate improvement in her sense of well-being. So again, going back to NICE Guideline 6, that well-being, that aim to improve, that is being adhered to there. And also as well, we were able to make a longer-term difference with the income maximisation for the household, but those shorter measures enabled that quick behaviour change to get the resident in a safe place with her heating of her home. Moving on to the second case study. This is a different perspective, and this is based around energy suppliers and really demonstrates the work that we do, not only advising directly with residents, but getting involved in the case of discrepancies with suppliers. So the family that we worked with were in the age range 50 to 59. There were 3 children under 19. Now, very sadly, the husband had a terminal cancer diagnosis. And so because of that vulnerability, it was absolutely crucial that we were able to support in this scenario and get the home back to a heated, safe temperature. So because the household had built up an energy debt of £2,300 and they were trying to resolve this complaint for almost a year, eventually they switched off the heating and now had pneumonia, which was exacerbated by that cold home. So it was really an emergency situation again. So we worked directly with the energy supplier, and this is something that we do regularly. We hold conference calls with supplier and the resident present, and we were able to negotiate a solution to cover the usage and start to pay a proportion of the debt. Now, sadly, as we do see from time to time, although this agreement had been made, the supplier did not take that forward, and so the problem was still standing, and we had to arrange 3 subsequent conference calls. Again, these were unattended by the supplier. So during this time as well, the supplier would also raise 2 further incorrect statements to the residents. So you can imagine at this point, given the terminal diagnosis as well, the stress that was happening in this home, just for a resident in this situation to have experts like Beat the Cold on hand makes a huge difference in their ability to function and get through such a challenge. So after a number of months of working on this case file, and we always say there's no case too complex, and we will work end to end on that support. So sometimes we work with residents on a one-off basis if they're resolved, their situation's been resolved. Sometimes we can work with the same resident for months and months and months, and we will look at all aspects of that until the work is complete. Now, we were able to get the supplier to wipe the whole energy debt of £2,300 because of their gross failure to resolve the complaint satisfactorily or meet with us on numerous occasions. As you can imagine, given the heartbreaking situation that these residents were facing, that was just such an enormous improvement to their well-being, and that also they could feel that they could reinstate their heating without any further worry and bring those comfort and safety levels back to the home. So we'll look at a final case study now. And again, this is a scenario where people are really concerned about that cost of living. So as you can imagine, the last 18 months have really been geared around this work. So Beat the Cold has seen many different external environments over the years and adjusted our service levels to that. And what we've seen in the last, I would say, since the height of inflation in 2022 is just a real surge of panic in residents because of the cost of living, and that has not resolved yet. Despite inflation reducing, we are still seeing people who are panicking because the cost of living is not coming down in the way that they would want it to or can afford it to. So this resident, again, was in the 50 to 59 age range and was an owner-occupier. They had health conditions, including stroke, limited mobility, poor sight and hearing, and epilepsy. So a lot of health conditions in the home with this family, with one child under 19. So they contacted us, as I say, because they were concerned about the rising cost of living. So we again performed a full triage, and we ascertained which benefits the residents were in receipt of. And we always do that to make sure, not only for monitoring purposes, but also to make sure we can maximise that income if there's anything that the residents are not tapping into. So as I stated, they're struggling with the rising energy costs, and they were really worried about how they could heat their home, particularly coming into winter. So first of all, we were able to tap again into that crisis support fund, £450 for a heat grant and a food bank voucher so they can maintain those body temperatures. And also as well, we were then able to work with some long-term measures because they were owner occupiers. It's very highly likely with that lower EPC rating that they would be successful, and they were successful for a retrofit grant funded solar PV and loft insulation. So in terms of the solar panels, we also then support with the aftercare of that, and we're able to provide wraparound support, advising on the usage and maximising what's known as SEG payments. The residents also, as well, due to the health conditions, were added to the priority services register. So because we were able to use a range of, again, of long and short-term measures, we were able to really get the residents warm and safe in the short term, but also make sure we've got that long-term energy efficiency for the property as well. And again, an improved sense of wellbeing was immediately reported, and we're now safe with this resident under NICE Guideline 6. So that concludes the presentation, and I very much welcome questions. Thank you.
Thank you for that comprehensive report, Fiona. Yeah, any questions from the group? Councillor Peters.
Excuse me. Fiona, that was really interesting and very detailed. A couple of points if I just made regarding clarification. You talked about focusing on 60 age group and the impact keep their properties warm now and maintain a healthy condition, state of health. Do you think we'll have to increase the thermostat in the home when they're trying to be very moderate in their usage? Well, because a lot of 66-year-olds are caring for grandchildren. I know from personal experience.
I'm ever so sorry to interrupt, but the sound keeps cutting out at my end. I'm not sure if it's your end or my end.
Microphone's flashing on. Let me start again. No? Any good?
That's better. Thank you. I'm sorry about that, Councillor. So I caught most of that around was targeting the age group of 66 plus and how they potentially will work with the thermostats to keep the home warm, particularly when they've got grandchildren over. Was there a bit more detail to add there?
Yeah, I just wonder whether you'd woven that into your appraisal of what was going on, the need to keep the house warm. Difficult for one, perhaps, but important if you're caring for grandchildren. Yeah, that's it for the time being. Thank you.
Thank you, Councillor. No, it's a really interesting question. And of course, it's the age old of how do we make sure that people can have affordable warmth when realistically, particularly in temperatures as cold as today, it would be likely that most residents who are vulnerable would need a thermostat to be on all day long to heat the property to at least 18 to 21 degrees. We appreciate that that doesn't feel achievable for some household incomes. And so that's where our energy advice tips really come in. So we talk about things such as heating the person, not just the house. We recommend also heated throws, blankets, layering, making sure that they've got good nutrition so that they've had a warm meal, because that will help with the body the ability to regulate temperature and not feel the cold, particularly around the extremities. We also talk about using things such as hot water bottles in a safe manner and adhering to use by dates. So there are lots of little things that we can advise on that fall outside of the thermostat and heating the home, but feel achievable for residents and make them feel that they're being proactive whilst not being too far outside the stretch of affordability. But it is challenging. I think we are in a challenging situation at the moment, particularly in that age group for certain residents, and we're absolutely making ourselves available. We're out there with outreach. We're speaking in different settings to make sure we reach the right groups.
Councillor Peters again.
Fiona, I'm not really sure whether you picked up on the point I was trying to make, the necessity to keep the house warm. I fully understand all that you've said, and that's perhaps the second time you've said it tonight. But do you think the influence of having to care for grandchildren will necessitate people to increase their heating? How are you going to take account of that? Because you wouldn't give a hot water bottle to a kid, I don't think. You don't want to be wrapped in a blanket when you go to see your grandma. You want to be doing all sorts of things.
No, it's a fair point, and sorry that you didn't feel that I answered the wider question. And what I would say is that grandchildren, being sort of a young age and vulnerable under the NICE guidelines, are also equally in the need for heating as are the older person groups. What I would say there is that, yes, it's important that the frequent usage rooms are heated. And so if the grandchildren are around in the lounge, for example, then I would encourage the residents to concentrate more on those spaces so that they're not heating in empty rooms, empty hallways, and they're able to direct that heating spend towards those rooms. Does that support a little bit more with an answer? Or?
Yes, I think so. I'll perhaps get back on the outside of the meeting, but I haven't quite got there in understanding your answer. Could I just build on the point you made there? Did you encourage people to get hold of an app to control the thermostats? That gives them more direct control of heating, sitting in the armchair watching the telly. Just click the app and you can increase the temperature or decrease it. Is that something that you're encouraging people to use?
Definitely. We really advise around low carbon technology. We've just recently completed a new pilot which was funded by National Grid to drive low carbon technology uptake, particularly in older persons groups, but also across the age ranges. And that can include any number of the low carbon technology aspects, such as apps, smart meters, hive systems. And we find that there's sometimes a little bit of hesitation because it's new and it's technology, but actually we're on hand to guide residents through that, and they do find it useful.
Okay, thank you. I think when you lose Wi-Fi, that's when the frustration comes. But thank you.
Thank you.
Thank you, Councillor Peters. Any other councillors? Councillor Holton.
Hello, Fiona. Can you hear me? Is that okay? Sound okay?
Yes, that's perfect.
Excellent.
Thank you.
Thank you so much for the report. It was very detailed and informative. I may have missed this. Did you touch at all on prepayment meters and those case studies and residents that you're seeing in the borough who have got prepayment meters and who are facing emergency energy issues and debts, where in our cases within our ward, there are residents that are actually going the weekend without electricity or gas. Can we touch on that a little bit, and are you able to give us some statistics on how many of those numbers Beat the Cold are working with?
Thank you, Councillor. It's a great question. I'll be totally honest, I don't have those numbers in front of me right now, but it's something I can get very easily and share with the group afterwards. So Beat the Cold do work with prepayment meters and with credit meters. On the whole, across the whole of Staffordshire, we work predominantly more so with residents who are on prepayment meters, and so we understand the intricacies of how residents can struggle with this. So there are, I believe, reforms coming to prepayment meters, and certainly I'm working directly with some of the energy suppliers to make sure that we're not penalising residents with higher unit costs through prepayment meters than those who are in the luxury of being able to afford a credit meter and a regular direct debit. So absolutely, we really do support that group, and we know that it is such a challenge for the poorest residents that we have in our communities, and so we really are on the case with that.
Okay, Fiona, committee looks forward to receiving those statistics, and as you mentioned and highlighted in the 3 case studies, perhaps a case study around prepayment meters and residents that you've dealt with directly would really be appreciated. Thank you. If I can, Chair, can I just ask another question? According to the End Fuel Poverty Coalition, Warm This Winter campaign, there are 8.3 million adults living in cold, damp houses. And you did mention those alarming stats on mortality rates rising. I think you mentioned 2.8%. Given that East Staffordshire has a sizable elderly population, and particularly across central Burton, large sections of old Victorian housing stock, where we know that damp conditions are prevalent, how worried are you that the winter fuel allowance could lead to a greater number of excess deaths across East Staffordshire?
Thank you. It's an excellent question. So just to reassure, we are working very closely with the team at East Staffs Borough Council with the additional funding that's being generated for damp and mould prevention and remedial works. Our team are all referring into these schemes already and are heavily on the lookout to make sure that this isn't, you know, this housing stock can be improved and improving health outcomes. In terms of concern for the borough, of course, we are concerned for all residents, not just this winter and in relation to the policy changes, but in general, that's our modus operandi, to be on the lookout for those vulnerable cases. I think the challenge, if I'm completely honest, with any service that works with vulnerable groups is making sure that the underserved communities are absolutely able to access our service. And so we are very proactive on outreach for those groups as well, because I'm sure some of you in the room will agree that unfortunately the residents who need services the most are not always the ones who reach out for them. And so it's really crucial to us that we work closely with the Borough Council to identify the right people and give that support.
Thank you very much, Fiona. Thank you.
Thank you.
Councillor Warman.
Thank you, Chair. Thank you, Fiona, and I just echo other councillors. It was an excellent report. Thank you. Can you hear me okay?
Yes, perfect.
Brilliant.
Thank you.
Thank you. I think from what I'd really like to know is how you get your message out to people that maybe are sort of just below or above the radar almost. I know that sounds silly, but the fact that, you know, it is generally understood that clearly when people get cold, you know, certain older people, I'm talking really here, they easily get ill, and then it takes them longer to recover. So the fact that, rightly or wrongly, you know, the winter fuel allowance that has been taken away from people, I think a lot of people are thinking, many people are thinking, oh my gosh, I really can't afford to heat my house. As I understand it, it is better to have the thermostat a little lower and heat the house or certain rooms, rather than just turn it off and then turn it back on. But how do you what I really want to know is how you can get your message out to those people that, you know, as I say, they're not vulnerable, but they are in respect, but they're not classed as. You know, some people a lot of people are too proud as well to ask for, you know, to maybe ring up and ask for benefits and things like that. It's a very difficult situation when you are, well, when you're in that, well, that situation really, yeah. And as regard to, yeah, I understand the idea of, you know, sitting in your armchair and putting the internet on, sorry, your app on and so on, but a lot of people, of course, as we know, and especially as Councillor Holton has just said, maybe don't have internet as well. As I'm just thinking about the people that are on prepayment meters and things like that. So maybe they don't have the internet. So yeah, my question is really, how do you reach those people, and you know, how do you get your message over to those people that actually, you know, they've lost that the winter fuel allowance, but actually, you know, that they've still got to try to keep warm and actually keep their houses warm, because as I say, we all know, you get this time of year in particular, you get ill. The older people, they really tend to, their coughs last longer, their colds last longer, and so on. So yeah, thank you.
Thank you, Councillor. No, it's a really important question and one that we're heavily focused around at the moment. So we are partners, as I mentioned earlier, and you'll all be aware that we're partnering very closely with the healthcare sector, and we are receiving in referrals from social prescribers who, I have to say, are a phenomenal resource for our county, because they really have their hands on what's available for residents. And you talked around perhaps the embarrassment factor or the inability to reach out. We find that social prescribers are able to convince people to take that support. So that's a really nice way in to beat the cold, because these particular residents might not always reach out to us. So we are making sure that we're furthering our links with healthcare. We've just retrained or refreshed, trained, should I say, a real significant number of frontline workers in healthcare, so that we can make sure people know how to spot opportunities and they know how to refer in. That program's already working, and we're seeing a real uptick in the number of referrals from healthcare. We're also got a significant press campaign out there. So we've released about 3 or 4 press releases since September, since the news was announced, just to make sure that people have some tips on affordable warmth, and also know to reach out to us, even if they don't consider themselves as vulnerable, as you say, that we're still here to support all residents. And that is our message this winter. So we've been out in the press, we were out on radio, we've got our own social media channels, we're working with local authorities to make sure we're getting the message out to the right residents. We also focus in a programme over winter time for outreach at community events to perhaps reach people who might not strictly look out for fuel poverty advice and support, but that we can bolt on and become a factor of interest there. So we've got a real programme of activities lined up. We absolutely appreciate, just like many winters, but this one in particular, that we've got residents who are concerned, but sometimes too proud to say that they're struggling, and that's where we'll be putting a lot of our focus.
Thank you, Fiona. Thanks. Very good answer. Thank you.
Thank you. Any more questions from the panel? Councillor Smith.
Due to the cut in the winter fuel payment, have you had any increased calls received since that announcement from elderly residents who are worried about putting their heating on in the winter?
Thank you, Councillor Smith. So we are closely monitoring this. In Q2 of the current year, which was when the news was announced, we worked with 28% of the service users were retired. That's slightly higher than the usual. So we've got an eye on the uptick there. We do forecast for winter time that by the time we come out of this period and reflect back, that yes, we will see an increase in these service users in that group. What I would say is it is always going to be challenging to know, is that because we've enhanced our outreach activities and really just made more awareness, or is it because people would have reached out anyway? And that's something we'll be measuring through our marketing campaign activities. But certainly we are expecting and here and hoping, that people do reach out, because that's what we're here for.
Okay, thank you.
Thank you. Any more questions from the panel?
I think there's a question on screen, Councillor.
Oh yes, I did see. Sorry, Councillor Beach. Thank you.
Sorry, Chair, I can't find my raise hand button anywhere on my
you carry on,
desktop.
Councillor Beach.
Bless you. Thank you, Chair. I just wanted to say what a fantastic presentation and what great work, and hopefully you carrying on for many years to come with that work. I noticed in one of the slides the statistics in relation to sort of uptake from homeowners to housing association and private rented. Now, I know there's various regulations in place for private rented accommodations in terms of EPC standards, and hopefully that's all having the effect it's supposed to have, and contributing to why that number is lower. I'm curious how the relationship is and how the dialogue is between yourselves and the housing associations. We know, as part of the health committee, we offer DFG support, for example, different reasons, but it can be quite problematic getting the housing associations on board. And I wondered sort of how those relationships are going, whether that does impact outcomes for residents, and whether there's any sort of plans in place if you were to improve those outcomes for residents, and whether there's any way we can contribute to assisting you in that provision.
Super, thanks, Councillor Beach. Really interesting question, and you're right. I think sometimes if you want to make something happen, enforcement is the only way to go, and we are finding that you have a very proactive council in this space. So we work, again, it's through the team who are overseeing the additional damp and mould support, is that's directly linking in to also to push forward for those enforcements where the properties are not found to be in a fit for living condition. So we are typically working very closely with that department, and that's a two-way referral process. And what we would say is that although we appreciate that housing associations are quite high in terms of the tenure split that we work with the service users, we would say that that's pretty much mirrored around the county, is that we tend to find more so usually local authority tenants and housing association, and that split can really vary depending on the makeup. So I know there's some boroughs and districts who perhaps don't have as much of their own local authority stock, and of course then those percentages will be lower. Some different boroughs and districts have higher percentages of housing association, and we naturally see that uptick. What I think is really interesting about the tenure pattern here, and I'm sure councillors would advise really more so on the tenure profile of your area, is that we have got a real high number of owner occupiers here at 35% that we're working with, and that's an interesting picture, a great picture. I think it's brilliant when people are owner occupiers and they do reach out for a service such as ours, because I think there's a common misconception that when somebody's got their own home and they've got a mortgage in place, that actually they don't need help, and quite the reverse, particularly with the cost of living. So I would say, reflecting back on your tenure split for the previous 12 months, that we've seen a healthy picture here. I think it's a good split, and we are proactively working directly with council colleagues to make sure we're reaching any homes that are not fit for purpose. Hopefully that answers. Thank you.
Thank you. Anyone else want to ask a question? Councillor Holton.
Yeah, just wanted to touch on waiting lists, really. Just reflecting on what you said about just the level, the high quality of service that you're giving to residents there. End to end, I think you quoted at some points 2 months to even to up to a year to work with one resident, which is understandable given the severity of some of the cases that you've mentioned. It just made me think that how are you coping with waiting lists, and what are your waiting lists? What is the status of waiting lists to be helping residents at the moment?
Thank you, Councillor. A really interesting perspective. And you're right, it can vary. Sometimes we work with the residents and it's one time and that's it. Sometimes it can be a number of months. I think the case where it was over a year, I believe that the resident had already been opening that complaint. So our involvement there was probably likely a number of months. But there are cases, I would say in the vast minority, but there are cases where things have been going on for over a year. In terms of waiting lists, the great news, we don't have a waiting list. We're able to manage our resource. We typically get back to people, and we don't benchmark this, but we typically get back to people within around 48 hours of work, 48 hours or a little bit longer if it's coming over the weekend. But very quickly, certainly within less than a week, we'll be out there and working with residents who need us. That's just through a combination of resource management. We work quite lean, and we're a charity, we have to, but we've got a real skilled operations supervisor who keeps a close eye daily on incoming enquiries, and we're able to draft different resources around the energy advice team and move people off projects if we're inundated with calls and so forth.
Okay. Thank you to Labour. I'm so sorry, Chair. It really is my last question now, Fiona. Household Support Fund, how important has that been for your service, and is there any way that you feel that can be improved or used, really? I am aware of who experienced that. Quite a few people are not aware of Household Support Fund, but I know you worked with the Household Support Fund, particularly those that are over 66. How are they referring into you, and have you been able to use the Household Support Fund, which has been extended now with your service?
Thank you. Really, really interesting question. And Household Support Fund, I think, has been a lifeline for many households. I think there's always concern when you put crisis relief in like that of how much behavioural impact that has on certain resident groups, whereby actually they become reliant on that. And that's something we do heavily keep a close eye on, that we're able to make sure we're supporting the right groups and that the money's going to the right people. Now, there have been changes at county level to household support fund in the last year or so, so this particular tranche. So the way that we refer in is different than we used to be able to do. So that is something that I'm in talks with county for the current tranche, because I am absolutely key that we make sure that household support fund is available for particularly the group that you mentioned, who it has been promised to in Parliament for this winter. And so that's something that I'm heavily pursuing. We are able to refer in. We just don't have the direct referral that we used to have. And so that, like I say, that's something I'm in talks with colleagues at county level. In terms of household support fund and the way that we're utilising that in other areas is we're starting now, because it's in sort of year 3, year 4, to really laser that focus on those cohorts. So I'm sure that Stoke-on-Trent won't mind. We deliver the fund directly for Stoke-on-Trent, so we have full control over how that scheme's delivered for fuel vouchers. And what we've been able to do this time is to put key cohorts in of residents who perhaps have not tapped into the support in the past, residents from underrepresented groups, which we're actively in the community doing outreach for, and also for residents who are 66 plus and not in receipt of pension credits. So I think that it's a great fund. I think there's a huge loss of potential that can happen with it. I think the county have a huge challenge on their hands in that it's such a vast fund with such a short period of time to deliver it. And their formula at the moment does work. It does go out to the right groups, but we're just looking at a mechanism that we can get new people referred into the fund as well quickly.
Thank you. Any more questions? I have a few questions, Fiona. First one being very simple one. Is it all right to share those PowerPoint slides? You can put it on the intranet and refer to them later. That'd be excellent. The second one is you're suggesting that there's been like in Q2 you said there's been an uptake of the amount of referrals who have for pensions, I believe, which is 28%. Do you think that's directly linked to the cuts in winter fuel payments, or is there some other external influence?
Thank you, Councillor. And yes, absolutely, I'll share those slides afterwards. I'm not sure would I be better to share with Daniel, who arranged, or with yourself. I'm sure we can arrange the detail after. So in terms of the uptake, I think when it's an early emerging picture, it's always difficult with any data to really ascertain, is this exactly that? But you've got the cause and correlation there that this news came out at the end of August, and all of a sudden we're noticing a marginal uptake in that service group. So I would likely say that is the case. And I think, again, that's in part because of the proactive outbound outreach and marketing that's been taking place. But yes, I should think that over winter time we will see an uptick in that group for that exact purpose.
Thank you, Fiona. You also mentioned about referencing schemes to improving the housing stock. Do you have any data around that? Is it possible to go, well, you've referenced this many houses, and because of that, there's this much improvement of the housing stock? Because it's my, if you improve all the housing stock, then there's a reduction in the need for, beating the cold, as it were.
Absolutely. And we definitely see the future of energy efficiency and fuel poverty reduction is in these retrofit measures. Of course it is. What we've seen in the last sort of 2 or 3 years where we've come out of COVID and then we've had the cost of living crisis, we've had the surges in inflation, we see less appetite in the marketplace for what we consider the longer term measures and more immediate crisis relief desire in the service users, because if they are struggling to afford heating, the idea that then we're going to come and organise something which will have a direct impact on the inside of the property, there's disruptions to the household and so forth. They don't want that always. They want now a fuel voucher, and that is that. So we've definitely got more work to do here. I think we're seeing certainly an increase in the number of referrals we're able to make for those retrofit schemes. We're absolutely passionate that is the way forward, but it's taking residents on that journey with us, and also we are a client-led service. So although we can recommend that might be the way forward, if that's not what they're particularly keen on, then we will focus elsewhere. But we'll always go back to that in the future and build towards it and make sure that residents know what's available for them.
Thank you. And regards to, I think Councillor Beach said a question regarding that sometimes possible housing authorities might not be on board with certain recommendations you have. Do you share those recommendations with the local council as well? So, I mean, we could see the picture, see what actually, if there's a need of changing of say contracts, for example. I was just wondering if like you'd share that information from your side with the council if housing authorities haven't been, say, playing ball with you guys.
Sorry, Councillor, you just broke up a little bit there. Let me just check that I understand the crux of the question.
Okay.
So looking at housing associations to see where we had recommendations, or
if there's like you put out all these recommendations for housing authorities, and these housing authorities can say, well, the recommendations, we don't have to do anything. I was wondering, is there, say, us in the council, as like we're a local authority, we can put pressure on the housing authority to do these measures?
Thank you, I understand now. So just to clarify then, so we don't give direct recommendations to housing associations, but we do work closely with local authorities. In the case of any tenure, so working with landlords, housing associations, if we find a property to not be up to scratch for whichever particular reason, and whether that's the damp and mould in the property or it's not adequately insulated, then we will in those cases highlight that to enforcement teams or particular strands of the council to make sure that that's taken forward. We don't actively collect statistics around that area or keep a dossier, as it would be, of direct recommendations that we would make. We tend to, if I'm completely honest, we tend to allow that to fall under enforcement, because Beat the Cold is that holistic service that's resident-led. And so we try not to get too involved in that side, but whilst being an advocate for residents when it's necessary.
Thank you, Fiona. Is there any possibility you have statistics of how many enforcement referrals you've made?
No, it's not something we track, unfortunately, because what tends to happen is that we might raise damp and mould, for example. We might go directly to the council and highlight a case of damp and mould, and then we don't get involved after that fact. So if it is then the case that as a local authority that's then taken forward to enforcement, it's not something that we would be involved in after the fact of the first referral. And so we work quite closely. We've had a meeting recently. There's a new employee in that section who is very, very proactive and passionate, and we've met really just to clarify the process and who does which bits. And we're really key that Beat the Cold, whilst we are here to feedback when properties are not fit, we're not here to provide that enforcement, and so it's not something we actively track ourselves. But certainly I know that at the local authority side, that's something they've got a real close eye on at the moment, particularly around the new investment and the damp and mould work that's happening.
Thank you, Fiona, and thank you for your detailed answers and to some interesting questions. I believe you're not quite done there, Fiona. I think Councillor Beach wants to come in again. Sorry.
Thanks, Chair. You asked the question I was going to ask, but I've had an afterthought. Would it be possible to get some sort of digital media in terms of being able to signpost people to your services for councillors to be able to use on their social media platforms or email platforms, and maybe some hard copies, I don't know, little business cards, something like that, so that should we, have residents reach out to us, we can signpost them safely and sensibly to yourselves. Is that something you could, I don't know, pop in the post or send in an email for the offer team to distribute if needs be?
Certainly, thank you, Councillor. We do have a raft of materials on file, particularly digital materials, but what we could do, and I'm happy to work with our agency to have something that's branded up with the joint logos, so they know that that's part of our joint service. That'll just take, you can imagine, a week or two to go through, but I can put that brief in the morning, particularly social media graphics and how people can refer into the service. And then we do have a small quantity of printed leaflets that are really geared around our Keep Warm, Keep Well service, but I'd be more than happy to put those in the post to one contact, and then they could be distributed at a future meeting. And particularly given the topic of your committee as well, I think the fact that they are the Keep Warm, Keep Well leaflets would be a real positive slant.
through you, Chair, I think that'd be a wonderful idea if one of the officers is happy to take that as on their email.
I have a few nodding heads, so that should be fine. Okay.
Super, thank you.
Any more questions? I think we're then done. Okay, well, I appreciate you spending time with us, Fiona, and thank you very much for that report. You're more than welcome to stay, or you're more than welcome to leave if you're bored of us. I'm sure you've done a lot of good here today. Thank you very much for your presentation. So with that...
Super, thank you.
Thank you, Fiona.
So just to finalise then, just from myself to esteemed colleagues in the room, thank you for your support this evening and for the service that you give. We're absolutely delighted to continue working with these Staffordshire Borough Council and your residents and fighting on behalf to get what is required. And if Councillor, you wouldn't mind getting perhaps Daniel to link in with me of where to send any of the follow-up actions, then we'll get those done as soon as possible. Good evening, everyone. Thank you.
Good evening, thank you. So, item number 8, briefing note on flooding responsibilities. This is part of enclosure 2. Are there any questions on that? I don't see anyone in the room. No. Okay, so item number 9 then, suicide rates scrutiny review. The final report for the suicide rates scrutiny review has been circulated in enclosure 3. Are there any questions on this? I see no one in the room. Councillor Holton.
Yeah, what I'd just like to say is thank you to the officer really in working with the subcommittee on this scoping paper. It has been triggering in parts and informative and highlighted what councillors had brought to the committee initially, really just in seeing and hearing what we were experiencing on the ground. There was just one thing, I think it was 2.1, where I'd like to ask for, I think the referral was referred to a local men's mental health group, and that local, sorry, 2.4, that local men's mental health and youth mentoring group is called MEND, as in MEND, and that's the service that assisted with the garden there at the hotspot in Shobnall. So if we could just highlight that service is active, it's still working with everyone active and is doing remarkably well in getting men from all walks of life and support from local celebrities, including Fraser Clark, to assist and highlight mental health for men in the area. Thank you.
Thank you. So yeah, if there's no other comments on the report, I'll propose to approve the recommendations as detailed at 4.1 and 4.2. Councillor Beach.
I'm really sorry. I'm flitting between screens. Can you still hear me? Can you hear me?
Yeah, carry on, Councillor Beach.
Fabulous. I just wanted to ask in the recommendations, the first recommendation internally, is that saying we have or we will?
Mike Avis.
Yeah. Thank you, Councillor Beach. There's already a significant amount of work that already goes on in promoting health to staff, and that's really to continue that with the 5 ways to mental health. So to answer your question, it's probably a bit of both. There's already a significant amount of work that is going on for staff's mental health, but we would recommend as part of that 5 ways to mental well-being is used as a framework to promote those activities among staff.
Thank you, Mike.
So as a statement, and then the last point, could we get any feedback on that? in advance of that mental health awareness week, could we perhaps have like a little mini item on an agenda to get some feedback on the content created as a result of the recommendation?
I feel that we're recommending to, and we're not putting in anything ourselves. So I don't know if we could do that. I'm not sure what you think, Mike.
Yeah, thank you, Chair. The recommendation is for Cabinet, and Cabinet will make a decision based on the report in front of us, whether we take the events programme for Mental Health Awareness Week forward.
Thank you.
Hypothetically speaking, if they were to take a programme of events forward, could we as a committee see that prior to it being rolled out, just as feedback from the recommendations that we've suggested? They've actioned that. Would we be able to receive the feedback in a timely way?
My understanding is I'm not sure how feasible that would be to pre-see it before it gets enrolled out. If it is enrolled out, I don't know how feasible that would be, Councillor Beach. Mike.
Yeah, thank you, Chair. We're talking in a hypothetical world, Councillor Beach, as you indicated. If we were to have a programme of events for Mental Health Awareness Week, I'm sure whichever council service is operating those events could come along and provide feedback as to how the events actually went with Mental Health Awareness Week, as we do with many events, and then provide any learning for what we might do in future years.
Thank you, Mike. Is that satisfactory, Councillor Beach?
Yeah, it can be. I was under the impression that as we, is it my understanding that you will present the report to Cabinet as a report, almost present the recommendations as the officers would present reports to us? It was my understanding that at that point you could ask for sort of feedback as they're going through those action points on which bits they're taking forward, which bits they're not, and how they're progressing with that. And I thought it'd be valuable sort of feedback. I know the guys have spent a really long time working on this report, and there's a lot of data in it. I just thought it'd be really interesting to see what the actions are coming out of that, feeding back from the report that we've delivered them.
Thank you. I think, Councillor Beach, I mean, with this is to approve of the recommendation. I'm not sure how feasible it would be to then get the recommendations to then also be relayed back to us if they're going to be done or not. It just doesn't seem fair to me to put that on an officer to take to Cabinet. So I do believe that we can't really facilitate what you're suggesting. But of course, if they do take it up, then of course they'll, the Cabinet will themselves, put this into action. Okay. Any more questions or comments from the committee? Okay. So I'll move then to propose the approval of the recommendations as detailed at 4.1 and 4.2, with the caveats that Monica, Councillor Holton alluded to, putting in place MEND. Do I have a seconder? Councillor Smith. We will now go to the vote. All those in favour, raise your hand. And that's unanimous in the room. Thank you. So going on to item number 10, the Scrutiny Review Programme Update. I now invite the Communities, Open Spaces and Facilities Manager and the Audience and Participation Development Officer to provide an update.
Yes, thank you, Chair. Members will recall that at our last meeting we discussed organising 2 focus groups, one around knife crime and care of the elderly. We will have an invite for December the 5th to prepare a scoping paper for knife crime, and December the 10th for care of the elderly. Charlie's sent those invitations out. If you've not responded around your availability, could you please do so at the earliest opportunity. Equally, if you haven't put your name forward yet for one of the groups, please do so, and Charlie and I will send you out an invite.
Thank you, Mike. Are there any questions about that? No. So we'll move on to item number 11, Staffordshire County Council Health and Care Overview and Scrutiny Committee Update. I now invite Councillor Legg and Councillor Atkins to provide an update.
Thank you, Chairman. We've had, as usual, busy time. I didn't manage to come to a meeting to report about the September meeting. We had the West Midlands Ambulance Service there. A lot of data on the website if you want, members want to catch up on that. We had quite a bit of talk about defibrillators, and there is a website, and don't ask me what the website is. I've not got it to hand, where you can find out where defibrillators are that are in action, and there are a number of guardians who keep an eye on them as well. And you'll be surprised, actually. There are some bits that are missing. We had a report from the Director of Public Health, the annual report, which is lots of detail about illnesses and things like that, and a progress report from Health Watch Staffordshire, which was of interest. As I said before, all the details are on the website. In the October meeting, which was about 2 weeks ago, we had an update from the Staffordshire and Stoke-on-Trent Integrated Care Board. They've got a consultation ongoing about freedom to speak up, an update about that. And then we had some updates from them about the Integrated Care Board, about the workforce and how that was going on, and where we had pinch points. And we had another report from the Cabinet member about adult social care workforce. We had an interesting report back from the Women's Health Strategy Working Group, and which has received a little bit of press comment about endometriosis, endometriosis, which is a very painful condition for women, which is very people have been waiting for diagnosis of up to 8 years, and so there was quite a lengthy report about that. And then the report back about district and borough health scrutiny activity, which was a report. I have to say that some of the districts are concentrating on their own particular issues. The Moorlands are very concerned about ambulance response time, so with the West Midlands Ambulance Service there, they were very much onto that. But that is the opportunity, if any of your work groups do pop up with particular issues for East Staffordshire, where you can raise them. That can range from, looking at Councillor Peters, from diabetes and people's diets and all the rest of it, to obesity in some areas, where poor diet has led to people being overweight, and then the consequent health problems and issues that come from that. Thank you, Chairman.
Thank you, Councillor Atkins. Councillor Legg, do you have anything to add?
Yes, thank you, Chair. I did go to September's meeting, but I haven't been to October's due to can't stretch myself that thin. So I would ask, I will go to the next meeting if I could join it on Zoom, please, rather than attend in person. Would be more beneficial for myself, because I find the trains quite unreliable. So I did go to September's meeting, sat and listened. There was things brought up about the need for nursing homes, care homes, improvements to antenatal care were brought up, how there's improvements in some things but not in others, but across the board there was slight improvement in the Burton and Derbyshire hospitals. And other than that, that was really all I bought from the meeting, because a lot of it didn't really impact on East Staffordshire. But a very interesting meeting, a very long meeting, and still happy to go, but would rather go on Zoom. Thank you.
Thank you. I'm sure that could be arranged to be on Zoom. I think you might have to get the secretary from Staffordshire County Council to maybe sort you out Zoom.
It'd be on Teams, Chairman.
Okay, Teams, Zoom, some video streaming service. So yeah, are there any questions for Councillor Legg or Councillor Atkins? I don't see any hands or anyone on Zoom, which I keep forgetting to look that way. Yeah, that's it then. Thank you very much, Councillor Atkins and Councillor Legg. So we go to item number 12 then, the public executive decision records. This is enclosure 4. A list of public executive decisions have been circulated with the agenda. Does anyone have any questions on any of these? I don't see any councillors wanting to speak, so that's all good. Agenda item 13 then, date of the next meeting is the 27th of January 2025. So that's all good. And we now have 2 items to consider in private, so I will now move. In accordance with Section 100A, Part 4 of the Local Government Act 1972, the press and public shall be excluded from the remainder of the meeting as it's likely, in view of the nature of the business to be transacted or the nature of the proceedings, that there will be disclosed exempt information as defined in the paragraphs of Part 1 of Schedule 12A of the Act, indicated in brackets before each item number on the agenda. Do I have a seconder for that one? Councillor Smith. We'll now go to the vote. All those in favour? Unanimous. And yep, go into private minutes. Thank you.